Hello, assalamu alaikum. It's a long one, I haven't made any video. I would like to discuss about some psychiatric point which is very important for the upcoming steps. First of all, starts with this major depressive disorder. In major depressive disorder, I have to remember the two things. That is, the two things uh, that is 52. I want to remember this 52. That what does 52 means? 52 means more than 5 symptoms lasting more than 2 weeks. More than 5 symptoms lasting more than 2 weeks. And it is the space, depressed mood, depressed mood, interest loss, guilt, uh, guilt, suicide, suicide, psychomotor agitation, appetite loss, concentration loss, concentration loss, energy low, and that's all. This is Dick space. Dick space. So 52 and Dick space is all about no history of mania or hypomania, no history of mania or hypomania, not due to disturbance or other medical condition, not due to disturbance or other medical condition. Duration of action of common benzodiazepine, midazolam and triazolam less than 6 hours, MT is less than 6 hours, lorazepam, oxazepam, alprazolam and clonazepam 6 to 50 hours, and it is intermittent acting and long acting diazepam, chlordiazepoxide, diazepam more than 50 hours, half-life is more than 50 hours, diazepam, chlordiazepoxide and flurazepam and among them out of the liver uh, which do not metabolize in the liver, lorazepam, oxazepam and temazepam. These three is out of the liver. These three works. These three works out of liver. Lora, oxa and tema. Lora, oxa and tema. Bipolar manic and hypomanic is a bipolar and related disorder. Manic symptoms are more severe 1 week unless hospitalized 1 week unless hospitalized marked impairment 1 week unless hospitalized 1 week unless hospitalized marked impairment or hospitalized marked impairment in social occupational functioning or necessary uh, may have psychotic feature. So in manic symptom is severe more than 1 week, 1 week, 1 week unless hospitalized and may have psychotic feature. may have psychotic feature, and hypomanic symptoms is less severe for or more than 4 consecutive days, not up to 1 week or 1 week unless hospitalization. There is no in hypomanic no psychotic feature. This is high yield. In hypomanic looks like manic. There is no psychotic feature. No psychotic feature. But in manic have psychotic feature in manic more than 1 week. In manic more than 1 week. And here marked impairment, but in hypomanic it is 4 or more than 4 consecutive days. Bipolar 1 manic episode and depressive episode, but not depressive episode common but not triggered for diagnosis. Manic episode is a must more than 1 week and have psychotic feature, and depressive episodes common but not record for diagnosis. Bipolar hypomanic episode, that means 4 or more than 4 days, and no psychotic feature, unequivocal observable change in the functioning from the baseline, symptoms not severe enough to cause marked impairment or necessitate hospitalization. In bipolar 2, one or more than one major depressive episodes. In cyclothymic, more than in cyclothymic more than two, 2 or more than 2 years of fluctuating mild hypomanic and depressive symptoms that do not meet the criteria for hypomanic or major depressive episode. To more than 2 years of fluctuating mild hypomanic and depressive symptom. More than 2 years of duration, more than 2 year, then chronic fluctuating mood disturbance for many years in such as cyclothymic, more than 2 years of duration. Diagnosis: 1 year in children, 1 year in adulthood. Okay, what is hoarding disorder? It's a new disorder in DSM-5 that is distinct from OCD. Hoarding disorder is distinct from Hoarding disorder is characterized by accumulation of large number of possessions that may clutter, uh, living areas to the point that they are unusable. Patient experience intense distress when attempting to discard. Patient experience intense distress when attempting to discard possessions, regardless of their actual value. Social isolation due to embarrassment, being unable to invite people to their home may also occur. Extreme cases may be associated with unsanitary unsanitary condition and fire risk due to blocked exit. Cognitive behavioral therapy, specially targeted to hoarding behavior, is the most effective treatment. Cognitive behavioral therapy, especially um, this is high Tourette's, multiple motor and one or more than one vocal take more than 1 year, not necessarily concurrent, multiple motor and more than one vocal take, motor facial grimacing, blinking, head and or neck jerking, shoulder shrugging, tongue protrusion and sniffing, vocalist grunting, snorting, throat clearing, barking, yelling, and corpulalia. And corpulalia. Onset less than 18 years. Onset less than 18 years. Tourette's. Behavioral therapy, habit reversal training, antidopaminergic agent, determinism, dopamine depleter, antipsychotic dopamine receptor blocker, and alpha 1 adrenergic receptor 1 percent clonidine, alpha adrenergic agonist 1 percent clonidine, and antidopaminergic drug tetrabenazine. The antidopaminergic drug like dopamine depleting drug tetrabenazine can be used, and antipsychotic risperidone and haloperidol can be used. Haloperidol can be used. Hyperactivity of the hypothalamic pituitary gonadal axis results in increased cortisol level. Has been associated with depression. Has been associated with depression. If some patients have MDD, which is evident of depressed mood, anhedonia, decreased appetite, early morning awakening, insomnia, low energy, impaired concentration, psychomotor agitation, hyperactivity of the hypothalamic pituitary gonadal hypothalamic pituitary adrenal axis, resulting in increased cortisol level without signs or symptoms of the Cushing's, have been associated with depression. So increased cortisol level in depression, there is increased cortisol level. I've heard these things a lot, that in depression there may be increased cortisol level. Why there is increased cortisol level? There is hyperactivity. There is a hyperactivity of the hypothalamic pituitary gonadal axis. The neurocytotoxic effects of hypercortisolemia may play a role in the pathogenesis of the depressive symptom and associated with cognitive deficit and associated with cognitive deficits. Manic, dig fast. In manic, what you have to remember, three or more than three symptoms lasting more than 1 week. Three or more than three symptoms, more than three symptoms. 3. So 31. For remembering manic, we have to remember 31. That means three or more than three symptoms lasting more than 1 week. Dig fast. Dig fast. Distractibility, impulsivity, grandiosity, flight of ideas, flight of ideas, increased activity, decreased need for sleep, and talkativeness, and decreased need for sleep, and talkativeness or pressure speech, severities, impaired psychosocial function, may have psychotic feature like hallucinations, may have psychotic feature like hallucination and delusion. We have psychotic features like hallucination and delusion. Age-related hearing loss stress by acquaintances is extremely common, affecting more than half of the people of all ages of adult more than 75. First of all, these kind of patients, the most appropriate next step is to careful history taking of hearing change and perform a whisper voice test. Audiometric testing can be used to confirm the diagnosis, and direct management like hearing aids and cochlear implants should be prescribed. Antisocial personality disorder APD. Antisocial personalities more than 18. Evidence of contact disorder before age 15. Evidence of contact disorder before age 15. These two numbers 15 and 18. Antisocial personality disorder 15 and 18. 15 and 18. Mm, Antisocial personality disorder. Antisocial personality disorder is 15. Antisocial personality disorder. Before 15 and after 18. Antisocial personality disorder before 15. History of conduct disorder before. Evidence of conduct disorder before 15. Evidence of conduct disorder before 15. And and it has to present age more than 18. Violates rights of other social norms, laws, violates rights of other social norms and laws, impulsive, irritable, aggressive, flights, assaults, impulsive, irritable, aggressive, flights, assaults, consistently irresponsible, lies, is deceitful, deceitful, lack of remorse, management, psychotherapy for milder forms, monitor for manipulation of therapeutic relationship, treat comorbid psychiatric disorder. There may be a term called antidepressant-induced hypomania, fluoxetine SSRI, these type of SSRI can cause elevated mood, decreased need for sleep, pressure speech. We know that all the antidepressants carry the risk for hypomania, mania, and a medication-induced switch of hypomania may suggest an underlying bipolar disorder. In addition, atypical rapid improvement after antidepressant initiation, and typical rapid improvement of depression after atypical rapid improvement of depression after antidepressant initiation compared to typical 2 weeks is an additional sign that she may have underlying bipolar spectrum disorder. In that particular case, immediate discontinuation of the antidepressant should be done. I've already studied this. Kleptomania, patient's anxiety associated with repetitive impulse to steal and is likely due to kleptomania. A rare impulse control disorder with typical onset of adolescence has urge of stealing something, but this is of low monetary value and are not needed for personal use. In here, guilt and shame typically follow, so these individuals may return or give away the stolen item. In kleptomania, it is created by psychotherapy and medication. Cognitive behavioral therapy should be chosen. In, in ASD, an autism spectrum disorder, social deficit with onsets in early development, difficulty sharing emotion or interest, lack of non-verbal communication, eye contact, and difficulty developing or understanding relationship. Restricted repetitive behaviors and interest. Restricted behavior and interest. In ASD, in autism spectrum disorder, in ASD,